Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine here. Welcome to our video series for parents. Today what we want to discuss is first aid for sea envenomations in the United States. Summertime's here, people are going to the beach along both of our coastlines, and kids are going to get stung. I want to place heavy emphasis on the fact that we're only talking about sea envenomations in the United States. Why? This may apply to sea envenomations elsewhere, but there are life-threatening jellyfish stings that occur throughout South America and throughout the Mediterranean, and we don't want to discuss those. Okay, I'm limiting myself specifically to jellyfish in the United States. We do not want to talk about the box jellyfish that are so common around Rio de Janeiro and South America and Australia. That's way outside of the scope of this. If you are not sure what stung your child, please seek immediate medical attention. If your child is having difficulty breathing, swallowing, lip swelling after a sea envenomation, seek immediate medical attention. Here in the United States, that would involve calling 911. Outside of the United States, depends on where you are, and I do not know how to access medical care in other countries. Please remember that this video series is not intended to replace medical attention. If you are concerned about your child, we're happy to see you here in my office, area code 775-359-7111, but we cannot help you over the internet, we cannot help you over the telephones. Please, don't call us and ask us. That would be bad medical care. So, what are we looking at in the United States? Well, depending on where you are in the United States, you're looking at either sea nettle stings, stings from Portuguese man-o-war, or other jellyfish, and then very common in areas where, especially where there's a lot of surfing, are stingrays stinging you. Stingrays will typically get you in the foot because you've stepped on them, and they reach up with their barbed tail and sting you because they don't enjoy being stepped on. The Portuguese man-o-war or jellyfish will have long tentacles. You may not actually see the bell of the jellyfish that got you. It may just be a tentacle that gets you. And how we handle these two things is just a little bit different. The good news is, in the United States, we don't have any particularly lethal jellyfish, so unless you're totally wrapped up in one, and in the case of stingrays, unless you happen to be Steve Irwin and get a barb right in the heart, most people live to tell about these. If you're not sure what's going on, please seek immediate medical attention. So how do we handle them? We'll start with the stingray stings, because those are a little bit easier, and they're pretty obvious. You're walking barefoot through the water and suddenly feel a sharp pain in your ankle or lower leg. This can go through a wetsuit. These barbs are very sharp, and they're flung with rather remarkable amount of force. The pain is severe and is excruciating. What do you do for this? And actually, this will also apply to if you step on a sea urchin. If there's a visible barb, you can try to remove it. With the sea urchins, you can remove any of the barbs you can see, but don't go dig after them. They'll just break off under the skin, and you're never going to get them out. Soak the affected extremity in water as hot as you can tolerate it, for as long as you can tolerate it. Divers Alert Network, and I'm a referral physician for Divers Alert Network, recommends for as long as you can tolerate it and as hot as you can tolerate it. These poisons that are in these barbs break down under heat, and so this will help to break it down. You can certainly use Tylenol or Motrin for discomfort, and if the discomfort is severe, see a physician and we can get your prescription for opiates. I recommend putting the unaffected extremity in the hot water as well. When an extremity is swollen and affected by venom like this, sometimes your sensation is a little off and you don't know that you're burning that extremity. If you put the unaffected extremity in, when it becomes too hot for the unaffected extremity to tolerate anymore, then you can remove both extremities from the water and thus avoid additional discomfort. If there's an open wound, clean it with soap and water as well and dress it. If it is a deep wound, see your physician. And if it's a contaminated wound because you're swimming in a known contaminated environment, then see a physician right away. In the case of jellyfish, those wounds don't break the skin. A lot of times, the tentacles will remain on the skin. So the first thing you need to do is get the tentacles off the skin. Do this by using a pair of tweezers or a credit card or even a knife to scrape them off. Do not use your bare hand or you will get stung with the unused up stingers, and there's millions of unused up stingers on a 1-inch piece of jellyfish tentacle. If at all humanly possible, once you've removed that tentacle, it's best to shave the skin to remove any of the microscopic stingers that may be left behind. Rinse the skin in salt water to remove any tentacles that may be left behind. Do not rinse it in fresh water. That will cause any stingers on the skin that have not yet fired to fire their poison into the skin. Once you've done that, you can neutralize a lot of the poison by adding vinegar. And in fact, Divers Alert Network recommends 4 to 5% acetic acid, which is a little bit stronger than vinegar. But regular household white vinegar is probably acceptable if that's all you've got around. And that'll neutralize some of the poison. Please do not put urine on this. Urine is not a recommended treatment for jellyfish stings. Once you've done that, you can actually apply some topical hydrocortisone, and some oral Benadryl will help. Tylenol or Motrin will also help with the discomfort. If you experience difficulty breathing, weakness in your lower extremities, dizziness, chest pain, discomfort in unaffected extremities, swelling of the lips or tongue, wheezing, coughing after jellyfish envenomation, seek immediate medical attention. Again, here in the United States, that's by dialing 911. In other countries, I don't know how to do that. Remember, we're talking really jellyfish in the United States. Outside, and I'm only talking about the 50 United States. Some of our territories throughout the Caribbean, like Guam, I don't know what kind of jellyfish are out there. And definitely if you're in South America, we're not, and Australia, we're not talking about box jellies here. These are very, very dangerous animals and way outside of the scope of this discussion. Certainly hope you're not getting stung. Okay, one way to prevent the stings from the stingrays, when you're walking through the water, instead of lifting your foot up, put your feet in the sand and shuffle them. The stingrays are much less likely to sting you if you kick them than if you step on them. You still might get stung, but it definitely will help to decrease your risk of getting stung. And of course, as soon as you can swim, you're better off getting your feet off the ground. We refer to this as the surfer shuffle, and it's better than getting stung, and it avoids a certain amount of stinging for you. I hope this has been of value for you. If we can be of any help here, we're at Sparks Pediatrics, 775-359-7111. We'll see you next time. Have a good summer.